Hello and welcome. Thank you for joining us for this webinar on strategic communication for universal health coverage, co-hosted by the USAID-funded Health Finance and Governance Project and the Joint Learning Network for Universal Health Coverage. My name is Gina Holtz, and I am a Principal Associate with the Health Finance and Governance Project. I will be co-facilitating this webinar alongside Lizelle Lagrada from the Joint Learning Network for UHC. Just a note for our listeners, throughout this webinar, we will continually refer to the Health Finance and Governance Project as HFG and the Joint Learning Network as the JLN. When speaking about universal health coverage, we'll use the acronym UHC. Before we get started, I'd like to go over a few housekeeping items to help you have the best experience possible today. We are using WebEx as our webinar platform. You can join the webinar either via telephone or through your computer. Once you join the webinar, be sure to click on the large telephone icon on your screen to make your audio selection. Next, I would like to mention that the WebEx platform has two features that we invite you to use, QA and chat. The buttons for these features are found on the top right-hand corner of the WebEx screen. Clicking on these will bring up small panels on the right side of your screen. Please use the Q&A feature to ask questions. We'll take time to field questions toward the end of the webinar, but we encourage you to submit them as they arise. When submitting a question, please be sure to send it to all panelists and note if there is a specific panelist who you would like to answer your question. You can use the chat panel to interact with fellow participants. You will see the Send To box where you can select who to send your message to. Please also use the chat panel if you experience any technical difficulties to send a message to the webinar host, whose name is Elena Sims, who will work to address your issue. And finally, please note this webinar is being recorded. It will be available soon afterwards on the HFG website. As I mentioned, my name is Gina Holtz, and I'm a Principal Associate with HFG. I'll be co-facilitating with Lizelle Lagrada, who is the facilitator for the JLN. We're very fortunate today to be joined by two colleagues from Nigeria who are working on strategic communication for UHC there. Dr. Neka Orjiachugo is a health economist with the Ministry of Health in Nigeria. Neka will discuss strategic communication for UHC at the federal level in Nigeria. Somto Mbelu is a knowledge management and communication specialist with HFG in Nigeria. Today, Somto will discuss communication efforts at the state level in Nigeria. So let's take a look at a few statistics about our online participants. More than 230 individuals from 50 different countries registered for today's webinar. Geographically, most come from across Africa, with others being located across Asia, Europe, and North America. As you can see on the pie chart on your screen, 28% of today's registrants are from a Ministry of Health or other government agency. Nearly half indicated that they are affiliated with an NGO, and the remainder, 23%, are with other types of private organizations. So it's great to see that we have such a diverse group of participants who I expect will be able to contribute to a very rich online discussion today. We'll begin today's webinar with a basic overview of strategic communication for UHC. Then we'll share highlights and introduce two new resources from HFG and the JLN. The first of these publications is a practical guide for strategic communication for UHC, which presents foundational principles of strategic communication. The second publication, which accompanies the practical guide, is a planning tool for strategic communication. The planning tool guides communicators through a structured process to compile a strategic communication plan that is adapted for their needs and context. Next, we'll share experiences and lessons learned in strategic communication for UHC that have been gleaned from countries where HFG and the JLN work. We're pleased to have the country experts I've just introduced from Nigeria joining us live today to do this. In addition, we'll feature insights from other country experts through the use of video clips. And finally, based on lessons learned, we'll reflect on how countries can use strategic communication going forward in support of achieving UHC. So what is strategic communication, and what role does it play in support of UHC? Fundamentally, communication is about the two-way exchange of information. Communication becomes strategic, however, when it encompasses deliberate, coordinated actions that we use to inform, to influence, or to persuade key stakeholders. These actions can engage UHC stakeholders in information sharing, dialogue, or collective learning with the aim of making decisions or influencing human behaviors. An important point I'd like to make is that strategic communication for UHC enables all actors to understand and also to realize their rights, responsibilities, and opportunities to achieve UHC. Progress toward UHC requires local ownership and customized strategies that fit specific contexts. This applies to communication as well. Diverse stakeholders must be engaged to advance toward UHC. These stakeholders are people like those who are listening to today's webinar. They include politicians and government officials, healthcare purchasers such as insurance schemes, healthcare providers, patients, suppliers, civil society, and citizens. Each of these groups requires tailored communication approaches to change their knowledge, attitudes, and behaviors. But we'd like to hear from our listeners. For those who are connected via the internet, you will see a poll pop up on the right-hand side of your screen now. The question we'd like to pose to you is, how does your organization use strategic communication to support UHC? So please select all the answers that apply. So again, the question is, does your organization use strategic communication to support UHC through social behavior change, advocacy for policy change, constituency building, public awareness campaigns, dialogue for resource mobilization, or other? Don't forget to click Submit at the bottom of your screen after you have selected all of your answers. We'll pause now for just a few seconds to allow everybody to complete the poll, and then we'll take a look at the results. Okay, we'll close the poll in just a few seconds, so please finish responding. About 10 more seconds. Great, thank you for everybody who's been able to respond. Okay, so it's possible that your organization could engage in any of these strategic communication activities as well as others. So in fact, there's no right or wrong answer, and I think it's not surprising to see that we have a diversity of answers from those who responded. It looks like the two most common activities are advocacy for policy change and dialogue for resource mobilization. So thanks everybody for your responses. Now let's talk more specifically about the new publications on strategic communications. For this, I'd like to hand it over to my co-facilitator, Lizelle Lagrada. Lizelle, over to you.
Thank you, Gina. Good morning, everyone, and good afternoon or good evening, wherever you may be. I hope you are you don't have any problems connecting to our webinar today. Again, this is Lizelle Lagrada, facilitator for Joint Learning Network for UHC. Over the past year, HFG and JLN have collaborated with 8 country delegations from Bangladesh, Cambodia, Ghana, Malaysia, Peru, Senegal, and Sudan as part of a joint learning exchange on the topic of strategic communication for UHC. Starting in March last year, the facilitation team led in-depth interviews with country delegations and subject matter experts and carried out a literature review on the topic of strategic communication for UHC. We convened virtual learning exchanges to discuss this topic among the 8 participating countries and to establish a theoretical foundation for the practical guide and planning tool. We had virtual learning exchanges to share country experiences and convened a 2-day workshop in Accra, Ghana in July of last year to test tools and engage in dialogue about what country delegations really need to be effective communicators. Based on the lessons shared in Accra, the facilitation team has worked together with 8 participating country delegations to co-develop a practical guide and strategic communication for UHC. We also engaged with subject matter experts as external reviewers to provide quality assurance. We greatly appreciate the contributions of these 8 countries and all of the work they have done in collaboration with HSG and JLN. Along the way, the country delegation shared their challenges, solutions, and experiences. They participated in webinars and an in-person workshop hosted in Accra last year. They also provided ongoing valuable input to the practical guide and the accompanying planning tool. Thank you so much to all who have contributed. Okay. The culmination of the work is the release of the practical guide and planning tool for strategic communication for UHC. Both publications are now available on the HSG and JLN website. The focus of our webinar today is to discuss these materials and the experiences of the countries responsible for creating them. These materials talk to each other and are complementary. The practical guide is the step-by-step narrative of key considerations for strategic communication planning to support UHC. It highlights some country experiences and case studies and provides actionable recommendations for how UHC champions might approach communication planning. On the other hand, the planning tool is an adaptable, editable file that outlines key decisions for developing a strategic communication plan to support UHC. The potential users of these resources are UHC and health policy champions, like those of you who joined us today at the national and subnational levels, seeking to achieve or strengthen UHC. You may use these materials independently or in collaboration with local communication experts who may serve as consultants for this work. The final output from the planning tool is an outline for comprehensive strategic communication plan for one specific objective, which may be grouped with plans for related objectives to execute a UHC-focused strategic communication campaign. Both the practical guide and planning tool are organized around a framework for strategic communication for UHC. This framework was co-developed by the 8 country delegations responsible for developing the materials, and it is intended to help conceptualize the main steps involved in communication planning and execution. The outer ring of the strategic communication for UHC framework provides us the guiding principles in developing the strategic communication plan. Communicating to diverse stakeholders about health system reforms require a foundation of trust and mutual respect between the communicator and those they are trying to reach. Observing a set of guiding principles can help build this foundation and ensure that communication is high quality and effective. To mention a few of these principles, one principle is the communication plan should be objective-oriented, meaning communication should be driven by specific, measurable UHC goal and objective. It is also leadership-driven, with political or management leadership to ensure credibility. It should be targeted and focused on specific audiences. The practical guide describes all these principles. Acting on this guiding principle, UHC champions may then use three-phase process for strategic communication for UHC. The phase 1 identifies communication priorities. Phase 2 develops or guides you to develop an action plan, and phase 3 is to implement and to adapt. Each phase contains multiple steps and opportunities for learning and adaptation. While we won't go into detail in each of these phases, 3 representatives from the participating country delegations have prepared short videos to explain the basics of each phase in this process. To introduce phase 1, identifying communication priorities, we have Dr. Mohamed Musa, a health economist currently serving as the Minister of Health in West Darfur, Sudan. He is the former Director General of Planning, Research and Policy at the National Health Insurance Fund. On the right-hand side of your WebEx, under the Participants tab, you will see a video appear. If you don't immediately see the video, please click the Participants drop-down menu and the video will appear.
Hi, my name is Mohamed Yusuf Ahmed Musa. I am the Minister of Health, West Darfur State, and I'm the former Director General of Planning and Research, National Health Insurance Fund. I'm also the member of Joint Learning Network for Universal Health Coverage. I am in the country group, core group. So I'm going to share a brief overview of phase 1, which is identification, communication priorities, is a practical guide and planning tool for strategic communication for universal health coverage. And phase 1 includes 4 basic steps, as you know. Step 1, articulate universal health coverage goal, and step 2, identify the policy stage, and step 3, conduct foundation analysis, while step 4, make a strategic decision. And I think the most important step is step 3, which is conduct foundational analysis. And conducting foundational analysis can provide a clear benchmark where you are stand at, and also it provides evidence for decision making and provide suitable information to advocate for the suitable objectives that we have to move to. And also it helps to set a specific objectives and provide clear way to draw the road for map for universal health coverage. So, and we are undertaking some steps in Sudan. Since 2010, when we established National Health Coordination Council, chaired by the President, where all stakeholders are a member, and the decision making and approval of the policies and some of the acts will be approved at this level, and it is high supreme level. And then in 2014, health financing review were conducted, and it provides some evidence about the situation of financing and health financing and public funding, and the healthcare expenditure and the out-of-pocket paid by the Sudanese people, and how far the poor families were affected by this situation. Thank you.
Okay, so that was Dr. Musa from Sudan. For phase 2, developing action plan, here's a short overview from Mr. Oswald Esua Mensa from the National Health Insurance Authority in Ghana.
Oswald Esua Mensa. I work with Ghana's National Health Insurance Authority. I'm going to provide a short overview of phase 2, which is communication action planning. Phase 2 has 8 broad steps, namely analyze stakeholders, prioritize audiences, develop key messages, choose tactics, establish time frame, identify assignments and resources, develop monitoring and evaluation plan, conduct reality check. I'll say that all the steps are important in the development of a communication plan. However, I'll consider developing key messages as the most important. The whole idea of communication for UHC is to be able to influence the thinking of people to, as much as possible, change their attitudes and behaviors towards a certain pattern of life. So it is important to deliver and develop key, concise messages, of course, to the right audience to trigger the desired change anticipated. In Ghana's context, at the introduction of capitation payments mechanism in 2012, apart from the wrong timing of the launch being an election year, the messages communicated for selected a particular region for the pilot were rejected by the target audience. And this caused a whole resentment for the program. So the NHIA had to refocus on developing more acceptable key messages which emphasize on the value to be derived by the target audience, and also situate the message as being for the long-term sustainability of the scheme. The GLN workshop in Accra last year was extremely useful to me. Since then, I have been adopting the principles of the communication guide and used the bridging phrases in most of my media interactions and interviews. We are currently developing a communication plan for a mobile money renewal project, which NHIS is embarking on. We are using the communication guides extensively, and I'm hopeful that the plan will help us to shape the awareness creation efforts and to change how our members renew their membership by the use of mobile devices. Thank you.
Okay, so that was Oswald Mensah from NHIA in Ghana. For step 3, implementing and adaptation, here's a short overview from Dr. Mariana Binti Mo Yusuf, Principal Assistant Director for the Section of National Health Financing in the Planning Division of the Ministry of Health, Malaysia.
Assalamualaikum and hi everyone. My name is Mariana Muhammad Yusof. I am one of the participants for this joint learning exchange. I am from Section of National Health Financing, Planning Division, Ministry of Health, Malaysia. Today I'm going to share a brief overview on phase 3 of the practical guide, which focus on implement and adapt. So this phase includes 3 components. The first component is continuous learning. The second component is adaptive measures, and the third component is staying on strategy. In my opinion, the most important is the first component, continuous learning. Why? Because this component requires active monitoring of the communication strategy and operating environment. So through these monitoring activities, the communicator can learn best practices and tactics that are effective to communicate key messages to the targeted audience and monitor the progress whether the strategic communication plan has reached the intended objective or not. Hence, it is crucial that monitoring and evaluation should be embedded into strategic communication from the very start of training phases. The lessons learned can help the communicator to revise the communication strategy, tactics, and messages. Currently, Malaysia is in the stage, in the planning stage to implement the health financing and transformation towards improving the UHC in the country. So therefore, the strategic communication plan which was developed has not been fully implemented yet. However, the strategic communication team has started to do media monitoring and stakeholder analysis to look at the sentiment among stakeholders and public on the implementation of the health financing reform. So both printed and non-printed media as well as social media are monitored and analyzed qualitatively. The findings then were categorized into themes which are related to stakeholders' concerns, expectations, issues, and suggestions. We also analyze the positivity, negativity, and also neutrality on the view of the stakeholders. The information gathered is important to develop the strategic plan, specifically in determining suitable tactics, drafting effective messages, and identifying spokespersons when we want to engage with the different stakeholders later on. Thank you.
So those are our 3 participants from 3 different countries sharing the 3 different phases in strategic communication for UHC. Again, everyone, you can type in your questions through chat and QA boxes as they arise. We will try to address or answer them before we wrap up today's webinar. Moving on, we will be inviting 2 of our colleagues from Nigeria for a real-time presentation. The Practical Guide and Planning Tool provide foundational guidance for UHC champions to develop and execute strategic communication plans. That said, the process of designing and implementing a plan is rarely simple or straightforward, and every context requires specialized approaches. At this time, as mentioned earlier, we would invite 2 of our colleagues from Nigeria to share their experiences. First, we have Dr. Nneka Orji Achugo. She's a health economist and leader committed to improving healthcare delivery in resource-constrained settings. Dr. Orji Achugo works with the Federal Ministry of Health in the Department of Health Planning, Research, and Statistics. Nneka believes in equity and fairness in health service delivery. She is currently leading work to develop a federal UHC campaign. Dr. Nneka, here.
Thank you very much. Hi, everyone. My name is Nneka, as she had rightly introduced me. So I'd like to share some experiences from the Nigerian setting on how we are working using the tools and the practical guide to develop our communication plan for UHC. So currently, the Ministry of Health has adapted and is using the practical guide and the tool to develop a national UHC campaign. And in doing this, we are currently partnering with a non-governmental, non-partisan health organization known as Nigerian Health Watch. We decided to partner with this local organization, considering the fact that it's a local NGO and the fact that they will bring neutrality into the entire process, because considering the vast stakeholder makeup that we have, that neutrality is very important to us in the entire process. And this group is actually trusted by all within the system. So we are attempting currently to use phases 1 and 2 of the practical guide to develop strategic communication plans for specific policy changes and behavior change objectives. Now, members of the partner organization, as I speak, they are currently undertaking an in-depth landscaping and stakeholder analysis to ensure that key messages are developed and these messages reach the right audience at the right time and in the right way. So we also intend to use a participatory approach to develop these key UHC messages and framework later this year. Again, the Federal Ministry of Health has already undertaken the design and implementation of a strategic communication plan for the rollout of the Basic Healthcare Provision Fund. Now, the Basic Healthcare Provision Fund is a statutory allocation that had just been, well, not recently, in 2014, it was signed into law, and this is supposedly supposed to provide predictable and sustainable financing for healthcare delivery. And then the goal of this communication push is to further raise public awareness for the Basic Healthcare Provision Fund, because not minding the fact that it was launched in 2014, it was signed into law in 2014. A number of people may not have not heard of it or don't even know what it means. They just know that there is a Basic Healthcare Provision Fund, but they really do not know what the contents or what it is going to be used for. So we're using this to support advocacy efforts at the grassroots, the state, and then also at the national level. For us, this is really the first step in our national UHC campaign. We need to get the critical stakeholders to understand the tenets of UHC and the BHCPF, and then also get their buy-in for us to move forward. In addition to the strategic communication planning at the ministry and other government agencies, we've also been working and meeting with a number of public and private sector leaders who support UHC in one form or the other, and we've had opportunities to share insights with them in different settings and different meetings. So one example that readily comes to mind is the recent engagements that we had with the team from Shell Nigeria. So in one of their dissemination meetings, we were invited, and Shell, being one of the nation's largest oil and gas producing companies, is very interested in the welfare of their truck drivers and even in the welfare of people who drive within the community where they do their business. And Shell also contributes to the national economy, and so they are really very interested in the welfare of the community where they're host, especially when it has to do with the drivers, you know. And so when we shared our work with them, they were really very interested because it aligns with what they were doing. They were actually looking for the appropriate messaging, you know, that will help them impact on the lifestyles of their truck drivers. So they were interested in developing appropriate messaging. So they were very excited when we shared the communication work that we were doing in trying to articulate our UHC messaging. So they indicated interest in continuing to partner with us in that regard, such that what we're doing can also impact on the lifestyle of their truck drivers and increase their productivity at work. So with that, we're actually at the moment working out modalities to broaden that engagement that we plan to have with Shell Nigeria. And we've also, in the last 2 days, we've also received some letters, you know, from other partners who have also indicated interest to come and, you know, be part of our work. And we're really very excited about all of that. Thank you.
Thank you for that, Neka. And it's very interesting to hear your experience in mobilizing resources and engaging other stakeholders in your country. As we see, there's an increasing burden from traffic accidents and other transportation issues, and it's very good to hear that Shell Nigeria is an active partner for you in communicating universal health coverage. Now, to move on, we have now Somto Mibelo, Knowledge Management and Communication Specialist in HFG, Nigeria. Currently supporting Lagos, Cross River, Rivers, Bauchi, and Sokoto through development of media and communication strategy for UHC. Now to you, Somto.
Yeah, thank you so much. This is just a brief presentation on our state level work here in Nigeria. Of course, NECA has done she's doing an awesome work at the federal level. But HFG Nigeria have been working on the state level to support, of course, feed into the work that the great work the federal level is doing. So in order to push or advocate for increased knowledge in universal health coverage or increased campaign, and also move the health financing reform forward in the state level, we felt that the best way we can educate, the best way we can send this information down to the grassroots is by working with the media. Of course, we all know the role the media play and how they influence policies and how they influence government decisions and also how people behave and how citizens behave. So we engaged the media. We had trainings for them on basics of healthcare financing and basics of universal health coverage. Amazing, during the pretesting some of these trainings, we discovered that these individuals had little or no knowledge in issues around universal health coverage or health financing. The platform and immediately after those trainings, of course, knowledge increased, and they also felt the need to increase this advocacy because we also used that opportunity to sought their support in regards to letting them understand that this is their personal issues, this is their problems, and part of their corporate social responsibility is to help push this message forward for so that the populace will be able to understand what universal health coverage is all about. And this has helped so much in pushing these messages. Also, as a part of our training in Accra, Ghana, with the JLN, it also improved some of the work that we're doing, which we also had some things that we already got into advocacy strategy that had this media and training as part of it. After this training, it's amazing that you could see that a lot of information, a lot of write-ups, a lot of articles on universal health coverage, started to flood the media in most of the states. And also, the State Ministry of Health, especially in Cross River State that we are working, also had a whole lot of free TV, radio, advert programs, to attend to and also to talk about universal health coverage. And this was as a result of this training. Then after these trainings, especially in most of the states, we asked ourselves, how do we keep in touch with these individuals? How do we keep in touch with the media? How do we foster this continuous collaboration and learning? We came up with the idea of a WhatsApp group. So in Cross River State, this has proven to be an amazing experience and success because we had the commissioners of health, the commissioners of information, and also important stakeholders in this group, and also the key media people, most especially the local media representative. Of course, these are people that know the language that the citizens understand, and these are people that have local programs and local languages for these individuals. So this WhatsApp group has proven so very, very, very successful as it also serves as a clearinghouse before news are published, before we have write-ups, before we have any articles pushed out on universal health coverage. We had that forum to really talk about this and also talk about how the messaging should go and how this will be put out for the citizens or for people to really understand. So we made use of the social media, which of course we know is also a very, very, very strong and important tool in disseminating information in this century. So advocacy strategy. Of course, the JLN in Ghana, like I said earlier, provided a very, very good platform for us to understand how we could put up this communication and strategies in such a way that it will be tailored to local context. And what we did was that we worked with these stakeholders through stakeholder analysis, through interviews in small groups in person with key stakeholders to understand what they think in regards to messaging and what they think to plan. So what we did was that we set up plans for this state, especially for these different states. Of course, they are different stages of setting up their state health insurance schemes. And these strategies were tailored in such a way that it's contextual for this individual state. So basically, this has proven to be a very, very big success because the states are already using these strategies and they are implementing most of the plans that were already outlined for them. And this has led to the successful launch of a Cross River State Health Insurance Scheme, which was launched by the Executive Governor, His Excellency, Governor Ben Ayade, sometime last week. And that got a whole lot of international attention to it. And the media, of course, played an amazing role because we have engaged them in 6 months or a year ahead of time with our trainings and with our collaboration both on social media. So, of course, they came out that day and they played such wonderful roles in regards to the questions, write-ups, and publicity that they gave. And already other states are already pushing out. And we are already replicating this. We are already pushing out these things in regards to setting up using the same strategy to have strategies on TB, extend it on HIV/AIDS, and also some countries are already replicating this, pushing their health financing reforms together. So I think this has played a very, very crucial role in making sure that universal health coverage is being put in a way that the local people will understand and also not understand, also act on the information that they have. Thank you very much.
Thank you for that, Somto. It's really exciting to hear what's happening in Nigeria right now, and I think you did a marvelous job of increasing your speakers or advocates for universal health coverage by engaging the media practitioners, and training them so that your messages are aligned and in sync. Now, we have some questions from our audience. For Dr. Neka, we have a question from James Hollett. Isn't the first area for communications is the primary healthcare clinics, staff, and visitors, and this requires structured planning. How do you do that, Dr. Neka? Would you care to share your experience in doing this?
Sorry, let me get the question again.
James Hollett asks, isn't the first area for communication the primary healthcare clinics, staff, and visitors? And this requires structured planning. How do you do this in Nigeria?
Okay, so can I go on and answer now?
Yes, go ahead, please.
Okay, so thank you very much for the question. If you recall, while I was making my presentation, I made mention of a basic healthcare provision fund, which was signed into law as part of a bigger National Health Act in 2014. So that Health Act articulates in what proportion, what agency does what. And primarily, it's going to be centered on, or it is centered on primary health care and revitalization and strengthening. So most of the huge effort is centered around the PHC strengthening. So in doing that, we recognize that for us, our PHCs are very, they're not in good shape. And for us, we needed to know what are those missing lanes within the PHC system. So we embarked on having a situational analysis to give us the real and true picture of what obtains in our PHCs at the moment. So from the results we got, it's also forming part of how we are articulating the messaging and whom we are targeting at the primary healthcare levels. For us, over time, our PHCs, which are supposed to serve as the first point of entry for assessing care, has been deserted by people. So we needed to improve on our demand creation. But in improving on demand creation, you need to make this PHC service delivery ready. So at the moment, we're doing a lot of work in terms of reshaping, the entire landscape of the PHC system within Nigeria. A whole lot of fund is going in there, a whole lot of capacity building and transfer of staff and all of that. So there is what we call the primary healthcare under one roof policy, which brings together the staffing, monitoring and evaluation, reporting system, all under one authority within the primary healthcare system, such that interventions and activities of all players within the PH system is well coordinated and well articulated. So all this huge effort, is going on within the PHC system for us, and getting the messaging appropriate such that the grassroots people are aware of this and they're taking ownership, being part of it. So that's very important for us, and that's why we're also concentrating a whole lot at the grassroots level while we're developing our strategic communication for UHC. I hope that that's provided insights to your question.
Thank you very much for that response, Neka. So as we gather now, your efforts in improving the PHC is actually driven by legislation passed a few years ago. I hope James got your answer. And we have a very interesting question from our colleague from Access Health, Babette Jain. We would like to address this to both Neka and Somto. He asks, countries with autocratic political leadership situation and limited media freedom, would working with media can be very risky situation. Any similar or close example available? What are the alternative channels that can be used? So let's hear first from Somto and then Neka to answer Babette's question.
Okay, so awesome. Thank you so much for that question. Of course, we know when we are getting to organize the advocacy strategy, we had audience segmentation and target groups. And of course, when you have the target groups, you have to understand the risks and the kind of messaging and the best way to tell all these messages to these different target groups. Of course, in your own situations, like for example, in Nigeria, we have some people in the remote parts of villages who do not have access, most of them don't have access to social media, they don't have access to maybe the mainstream media. So what do? We get to work with the local chiefs and religious rulers, people that are closer to the people that speak to the language that people understand. Especially here in Africa, we have a traditional system where we look up to, most of them look up to our traditional rulers, and we have great respect for our religious rulers. So we can also go through the religious and traditional means where you could speak to people. Of course, we know that everybody wants to be healthy. Health, they say, is wealth. And when you bring issue of health, and let them understand that this is our problem, and for us to solve this problem, we all have to come together to make this happen. So I believe when you cannot make use of the journalists or the media, especially countries that are strict in issues like this, we can also look at how do we work with the traditional rulers, how do we sensitize the religious rulers, and how do we also work with also the town criers, people that have access to the grassroots people in terms of making this message. Most importantly, we have to make this an issue that has to appeal to their conscience, like making them own this problem and understand that this is our problem, and the only way to solve this problem is to increase advocacy for people to know what to do, especially putting it in such a way, the message in such a way, not to spy the government, but also let the government understand that this is in their own interest. Because when you invest in the health of the people, you also invest in the economy, because the people have to be strong to be able to raise the gross domestic product of that country. So it is all in our own interest. Depends on how you make the messaging go. Thank you.
We do. Thank you for that, Somto. So we use our traditional channels to communicate. And let's hear from Neka on this question. Neka?
Okay, so thank you very much. So I've actually been thinking about the question. So in a setting where the media, they don't have a safe environment to work, just like Somto had alluded to, partnership becomes very important and very critical. You can't do it all alone. So reaching out to critical stakeholders for us. I think relatively in Nigeria, we have a safe environment, the media to work, but does not mean that we've not encountered a number of challenges here and there. But in the course of our work, we've also identified the civil society group as a very critical and important stakeholder to work with. No matter how unsafe that environment may be, we know that the CSO groups, would delve into very difficult terrain, and reach out to critical stakeholders, reach out, in the words of Sonto, reaching out to their conscience, because it's not just about the grassroots. We're also talking about political office holders and all of that. So for me, I think that partnership has worked. It could be tried, anywhere else. The CSO group and other development partners, they are all critical stakeholders and partners. We could drive our messages through, and then it gets across and down to those people who need to listen to us, who need to hear us. So I reckon that in those unsafe environments, the CSO groups could come to the rescue, including the development partners. They have a way of reaching out to these people who wouldn't ordinarily listen to the government worker or even the everyday media people within the system. Thank you.
Thank you so much for that, Neka. So you're saying that aside from using the traditional or the grassroots communication channels, also go straight to the stakeholder that you really want to influence. If the media is not or risky at the moment, to use or to mobilize. So, in the interest of time, we are getting a lot of very interesting questions. Continue sending them because we can answer them through a blog or after this webinar. But for our last question that we can answer this morning, we have one from Elaine Yao, who asks, what is the biggest challenge in health communication for UHC? Is it money, education, I guess education of both the communicator or the audience perhaps, the human resources to do the communicating activities? So in your perspective, this question goes to both our speakers. What is the biggest challenge in communicating for UHC? First, let's hear from Neka.
Okay, so I think the biggest challenge is stakeholder interest. So in communicating, you interact and engage with these critical stakeholders that you would have identified. And in the entire engagement, you see that at each level, different stakeholders wield different levels of power, and they also have different interests. There may be conflicting interests, there may be colliding interests, there may be interests that clearly align with each other, but you find out that everybody wants their interests to be protected, to be included in the entire plan. So when you have all sorts of interests, it's also not easy trying to make sure that everybody's interest is protected, and then the messaging is crafted in such a way that, you're not misunderstood by a different group. I'll give an example. For us in Nigeria, we have two main religions, and the Christian religion and the Muslim religion. So currently, we're working on making sure that insurance becomes mandatory within the entire health system. And then down some area, insurance is acceptable, it's okay. In other parts, they don't want to hear insurance. So they tell you, no, if you want to do this policy or this national policy, we don't want it to be called insurance because we're not interested in insurance. It's against our religious beliefs, So being in the middle of this, trying to explain and making sure that you're satisfying, the different stakeholders is a huge challenge. So for me, that's one challenge that really stands out.
Thank you for that, Neka. So as you pointed out, while communicating is important and effective in changing behavior, sometimes you need also to use a stronger instrument like a mandatory policy to move forward the UHC implementation. So let's hear from Somto.
Thank you, Neka, for that addition. So, in addition to what Neka has said, I think one of challenges is number one, health is not in this part of the world, or most of the time, health is not really an interesting thing to sell, because people or most governments feel that it doesn't bring in money, that much, or it doesn't turn on money that much than other economies where they put in a lot of money and all that. And you find out that when you go to advocate or sell this, especially to the policymakers, they don't really see the reason why they should, put in more money for health, for universal health coverage, or for example, promote whatever universal health coverage stands. So I think that's one of the challenges. And also, secondly, sometimes people, especially when we went to do some of the key interviews, especially area of insurance, because of past experiences people must have had in area of insurance, they are so skeptical on if they put in their money, if they take part of this, will it going to work? Maybe because of bitter experiences that they have experienced before in the area of such schemes or insurance schemes. But I think the well-tailored advocacy in regards to reassuring them that once they key into the schemes, it will actually also work out well. And in terms of encouraging the government, you can also let them, like I said earlier, that if you put in more money into making your people healthy, your workforce will be strong. And when your workforce is strong, they work so hard at putting money into the economy, and together the countries' gross domestic product grows. Of course, which country wouldn't like to have the economy, improved?
Okay. Thank you for that, Somto. And again, thank you everyone for sending us your questions. This webinar is richer because of your participation. For the questions that we were not able to address this morning, this will be addressed directly via email or in post-webinar blog post. So I'll give you back to Gina to wrap up this morning's webinar.
Thank you, Lizelle, and thank you, Neka, Somto, and our virtual presenters for sharing your insights today. As we prepare to end the webinar, I'd like to bring us back to where we started and where we aim to go. Despite strong global commitment to achieve UHC, there is inconsistent understanding and communication about UHC, and this hinders progress. Experience from HFG and the JLN suggests that advocating for and communicating about UHC requires deliberate, tailored, context-specific strategies. Specifically, we've identified 4 key lessons to improve communication that support progress toward UHC. First, it's important that stakeholders have a common definition of UHC that applies in their context. This lays the foundation for priority setting, and it makes people aware of their roles, responsibilities, and their entitlements. Second, UHC is a political endeavor, and as Neka pointed out, stakeholder interests and beliefs must be addressed. Sound technical knowledge, for example, on the costs and the benefits of primary health care, is required to build common understanding and vocabulary. As we heard from Somto, in 3 states in Nigeria, HFG trained journalists to become better advocates of UHC by developing and sharing accurate messages about the benefits of a new state-level social health insurance scheme using various media platforms. Third, the task of leading UHC-related communication often falls to technicians who are charged with implementing the reforms. These people may understand the mechanics of UHC, but they often lack communications expertise. Strategic communication requires different skills and knowledge, and it has to be implemented using a comprehensive communication plan. And fourth, because advancing toward UHC is an inherently complex and controversial process, reforms usually generate gradual change. They require continuously managing changing political tides and public sentiment. Today, as we heard from NECA, we heard about the importance of partners to make progress toward UHC. She mentioned an example of a public-private partnership where the Federal Ministry of Health is collaborating with Shell Nigeria to develop tailored messages for truck drivers to encourage behaviors that will include road safety. For more on these lessons and additional country examples of strategic communication for UHC, please download the brief from HFG that you see on the HFG website. And please remember to check out the practical guide and accompanying planning tool for strategic communication for UHC. Both can be found on the HFG and the JLN websites. We've heard from the JLN countries that they're already using these materials. To develop your own strategic communication plan, please use the practical guide and the planning tool, which can be adapted. We hope that you have found the information and discussion on strategic communication for UHC presented in the webinar to be useful. On behalf of HFG and the JLN, I would like once more to thank our two panelists who joined us live from Nigeria and our colleagues who recorded videos to share their experience. And finally, thank you to everyone for their participation. Have a good day or evening, whatever the case may be.